Hi, good evening, everyone, and welcome to yet another session of Startup Buzz. As many of we have this session which has everything to do with startups every Thursday, 5 p.m. So you can actually, time your watch. This Thursday, we have Milan, who's moderating a discussion with Rangarajan. Right. So I'm going to leave it without further ado to the two of them. Milan, I'm going to request you to introduce yourself and Ranga and,
Sure,
start the session. I'm going to step back.
sure. Absolutely. Thanks very much, Ravikant. Hi,
Thanks,
Ranga.
Abhijit. Hey, hi, Milan. Good to see you.
Likewise. I really do apologize. Ravikant said that we start exactly on the dot at 5 o'clock every Thursday. I've just managed to upset that record because of a technical glitch. So I apologize for keeping you all waiting. Welcome to this week's CII Startup Buzz, everybody. The motion for today's discussion is why most healthcare startups break in the real world. It's an interactive session, so I request everybody out there watching to please put your questions for Ranga in the chat. But please try and restrict your questions to the topic itself, why most healthcare startups break in the real world. So with that, let me begin by introducing Ranga. Mr. R. Rangarajan Iyengar, who's better known as Ranga, is the founder and CEO of PocoCare, a platform building India's first integrated emergency readiness and response infrastructure. The aspiration is to become India's 911. Ranga must have been marriage market gold when he was in the market because he's an alumnus of both IIT Kharagpur and IIM Lucknow. He spent over 2 decades in tech, operating at the intersection of healthcare, technology, and large-scale execution. Sorry. I was just checking on ChatGPT, my new best friend, what the defining characteristics are of medical startups that actually make it. And the most defining characteristic that they came up with is, interestingly, the rich experience of their founders in technology, healthcare, and operations, which is exactly what Ranga has been doing for the last 20 years. During the COVID-19 pandemic, he led a large-scale helpline initiative that served over 5 lakh people and managed 7,000 to 8,000 daily inquiries at peak demand, reinforcing his focus on building reliable systems during crisis moments. Beyond his professional work, Ranga is a cricketer, cricket enthusiast, writer, travel lover, cook, cryptic crossword enthusiast, and a firm believer in the power of positive conversations to drive meaningful change. And Ranga is based in Bangalore. So Ranga, to get started, why PocoCare? I mean, what does PocoCare mean?
So you spoke about positive conversations, and PocoCare is a short form of care with positive conversations.
How interesting! Wonderful.
Yeah.
So can you tell us in perhaps maybe 4 or 5 minutes what does PocoCare do exactly? What's the business model and what do you do?
So I'll talk a little about it's very important to understand the medical emergency infrastructure and the reality to sort of give a context in terms of what got me interested in this space and what got us passionate towards building the 911 for India. And I've lived in the US for some time and seen how 911 works. So when I came back and I had a stint at Apollo Hospitals as well as the CEO at HCL Healthcare. And, that was a time when Vande Bharat started, and on Vande Bharat, you see Azadi Ka Amrit Mahotsav embedded on it. So on one hand, we celebrate Azadi Ka Amrit Mahotsav, and on the other hand, our medical emergency infrastructure is compared with 1950s, 60s of the US. So that sort of seemed very contrary to what we were really celebrating. So I dug deeper, and like you said, the COVID time, the helpline, and the work that we were doing got me closer to medical emergencies. Of course, uh, it was not the norm. It was an exceptional time for all of us. But some of the statistics are true even now. For example, 90% of the time people do not get timely medical attention in India even today. And what that means is, against the golden hour requirement of 60 minutes when you get clinical attention in India, the national average, and this average is true across urban, rural, semi-urban, etc. And this average is 2 hours 10 minutes. So that's the almost 2.5 times the required time, and that translates to 24,000 deaths every day. And my goal was, can we at least look at saving 100 lives to start with? One life to start with, can we save a day, and then 100, and then 1,000 plus? And if we have to do it, we can't be exactly like 911 because the infrastructure there is so good. We are like 70, 80 years behind. So how do we bring in design thinking, and how do we really address this? So, we were racking our heads, and what we realized was, that's where the engineering, you spoke about technology, healthcare, operations, at the confluence of it. So, what we basically said was, why is it 2 hours, 10 minutes? So, can we break that down? And can we somehow figure out a way to reduce the time? So, the reason why PocoCare exists is to bring you the fastest medical emergency response. And of course, being a tech-focused company, the idea was to say that we will bring you the fastest medical emergency response at your fingertips. So it was fairly simple now that I say it in terms of the solution that we came up with. But at that time, it was not easy, because when we broke it down, we realized that the first 20-25 minutes actually goes off in trying to figure out where do you want to go, which hospital do you want to go to.
Yeah.
And first of all, let's say we are on this call and something happens to me. It's a bad example, but just to drive home the point.
I have to agree with you. It is a very bad example because another half hour to go.
Yeah. But on a serious note, you and I, we met, but we have no idea about each other's insurance or medical history, or you don't even know my family members or anything. So for you to be able to do anything despite your best intentions, it is going to be impossible. So we said, how can we reduce this anxiety? And the ecosystem, when you talk about a medical emergency, is also very disjointed. There is medical history, then there is insurance, then there is a doctor, then there is ambulance, hospital. So how do you actually bring all of it together and with the least stress, and then how do you reduce times? That was the thinking. Then we said, can we look at what really happens? And we broke it down, and the problem is things happen in a sequential manner.
Ranga, sorry, I'm going to have to ask you to just because there are
I'm aware of time. I'm looking at
continue, but just
I'm looking at the time. Don't worry. Okay. So the idea is to personalize a medical emergency response plan. So I collect data, I create a personalized response plan, and make it super easy for anybody to raise an alert for anybody. And then the single point of contact is PocoCare. So we orchestrate the response, point you to the right hospital, arrange an ambulance anywhere in the country for you. We pre-notify the hospital and keep your near and dear ones informed in a medical emergency, so that things happen in parallel rather than a sequential manner. And on top of that, we also get a doctor consult done in case you need a clinical guidance, so that you don't have to wait till you reach the hospital. So the whole idea is, if you're able to do it, can we get you to the hospital under an hour, and can we save a life or reduce the severity risk? That's what we set out to do. And since I'm having this forum, I'm very humbled to share that we have saved more than 150 plus lives. So we have hit that first benchmark of saving at least a life a day. And
Fantastic.
and we have a total of about 7 million users that avail our services today. So those numbers are actually going up every day. And our model is more B2B. So we work with corporates, position ourselves as a employee benefit, and we'll talk more about it when we go into why it is difficult for healthcare startups to succeed. So I think that's the agenda. But net fastest medical emergency response at your fingertips. Emergency readiness is a concept that we have introduced, and that's why we say that it is end to end, because we start with readiness so that the response becomes the fastest, and it is not just an ambulance.
Fabulous idea, really, and it's great to see that the private sector stepping in, where actually it's supposed to be public infrastructure that's supposed to do this job. So great. Now there's a question here, and everyone talks about disruption, but what does the healthcare system actually want preserved rather than disrupted? I thought that would be a good question from the audience, because you are preserving the general infrastructure, you're utilizing that infrastructure, but you're just stitching it together, right?
I think if I were to take us, and feel free, I might just go trying to give a long answer.
We've got 254 people on this chat, and they're already like, I don't know, 10 questions. So no, but I don't want you to not complete a point.
I think keeping the subject of the discussion in mind, Milan, I think the context of disruption and the reality of adoption, and when you're trying to build a business, getting the unit economics in play, all these three things have to act in unison. Otherwise, innovating for the heck of it and disrupting for the heck of it is not going to lead to innovation, to adoption. So somewhere, when we talk about disruption, when we talk about preserving something that already exists, I think the context is to see what is it that you're actually solving, and is there a product market fit that you can get early. And be aware that you may be building something that can save lives, but when you go and sell to a buyer who your buyer is and is he willing to pay money for that, it sounds great, right? I mean, hey, it's great that you're saving lives, but if you're not willing to actually pay for it as a subscription, and only willing to pay for it if there is a need for an ambulance, and sort of commoditize the entire offering, then you're living in an idealistic world, which is not going to help you build a real business. I think that's what we are trying to talk about here. That get real customers, get real money, and make sure that your disruption is not just appreciated in words; it's also appreciated in the form of real money. By paying for it.
Absolutely. Incidentally, while researching this subject, I came across the same point that many fail because customers are not willing to pay. They're happy to browse, but not to pay. So yeah, absolutely. Why do so many healthcare startups win pilots but lose scale?
I think it's a mindset issue, and I would, I am not pointing out the exceptions here, but I will generally tell you that these startups are desperate for showing that there is a value in what they are building, and the ability to, the willingness to run a pilot is very high. And anybody can run a pilot if somebody comes and says that I'll run this for you, and then you see the success, and after that we will, after that we'll deploy. But I think the clarity in terms of what happens if the model is successful is not, one second. What happens if the model is successful is not actually discussed well in advance. It's more an intent. So what really happens is, we are, when it comes to B2B, the willingness to pay is a massive reality check.
Mhm.
I will not name the company, but I was talking to a founder who is in the diabetes management space, chronic disease management space. Awesome solution. Thought about AI, deep tech long back. Started working with certain payers, and when it came to actually deploying the solution, and the solution is about $20,000 a year, and the willingness to pay was about $200 a year. So that's the gap. So when you talk about providers, that's the same gap. There are people who are happy to do the pilot, but as it translates to when it has to translate to real revenue projects, then we see that there is a huge gap between what the startup or the founder is expecting as a subscription money versus where is the willingness to pay. I think people are willing to pay after the outcome is established, not walk through the journey of the company in terms of looking at your cost, looking at supporting you, and therefore a lot of pilots do not actually translate to projects and people, but people, founders are the most hardcore optimists, so they still believe that some magic will happen
Yeah.
and get very practical.
In your business, I mean, your business is somewhat akin to buying an insurance policy. So yeah, people should be willing to pay for that, shouldn't they?
See, I'll give you a reality check, Milan. When we got into the space, the whole, every conversation was about in a real emergency, people are not going to really haggle on price with respect to an ambulance. This was a natural thing to assume, or the hypothesis is this. But in reality, you will be surprised. There is somebody who is dying, who is a close member of your family, and you are actually talking about, how much is the price? What is the difference between a ALS and a BLS? If I use a BLS, it is only 20 minutes. If it saves me $500, or insurance should be not reimbursing, but it should be cashless. Why is it this way? And I'm like, man, just go and just take a call. Which hospital do you need to go to? The guy really wants to do the entire research at that point in time. So I think the reason why I'm bringing it up is the assumption that people are willing to pay needs to be stress tested. And when I say people, whether it is B2B, whether it is B2C, whether it is B2B2C, there is a ceiling. It's a very price sensitive market. So don't make, wrong ARPU assumptions. So we learned it the hard way. I mean, something that we thought will be at, I'm not quoting exact numbers here, but let's say $1,000. Now I know that it is at $100. So X by 10 is the pricing. So we had to quickly figure out how do we build scale, because somebody spoke about disruption. So you're not going to be, you may be disruptive. I want something that you are innovating. I want something that you are giving me which is extra. But the fact that I have to pay a premium for it, that's not what the majority, that's not what the majority will be willing to do, whether it is the B2B or the B2C space. Yeah.
But I think Indians, I mean, we're just value hunters by training or yeah. So by culture.
Yeah.
But other than price, if you had to give a founder of a, you just spoke about that one founder who
Yeah.
you referred to earlier. If you had to give a founder one health warning before he enters the healthcare space, what would it be? And
I
non-price, not price, something else.
Non-price, I think the be very clear about the real value, uh, because what I've seen is there are two things actually. One is about the real value. Why do you exist has to be super clear. Because what I see in healthcare is people start somewhere and then they start looking at the limitless horizon that healthcare has, and they start talking about adjacencies way too early. So the core gets diluted significantly by the time you are. I mean, it's okay to sort of pivot and get somewhere. Most startups have the license to do that. But I'm just saying that have you tried hard enough to really solve what you're solving? stay focused on that. That is definitely one bit. And the second bit is be very clear about how the market operates. And I will explain that with my own example. When I was in my previous organization, we were talking about employee benefits, and corporates used to buy employee benefits very differently from how they buy today. After COVID, especially, the dynamics has changed.
Correct.
So the interplay between a benefit platform, insurance, TPA, wellness platforms, all of them are offering similar, or have the capability to offer similar services. So where you fit in, how that interplay happens is super critical. And go beyond just the tech thinking. I think people think that if there is tech, people will adopt. That's not the solution. You got to go meet customers. You be real, get real. I think that's the key. Apart from my mantra of being super focused on real operations,
Yeah.
so these are some of the things that come top of mind if people were to accelerate getting to product market fit and real unit economics understanding. Long answer, but yeah.
No, it's a very valid answer. What is the biggest misconception in your mind, to your mind, Ranga, that founders have about selling to hospitals?
I think sales cycle is, see, I'll tell you, we all know it's out there in the public space, so I'm not saying something. Uh, but the point is, if you look at the way hospital market is evolving, and I'm not talking about the clinical side of it, I'm talking about the P&L side of it, right? There is massive interest from the private equity world, and therefore you are solving something, but do not divorce it from the realities of a P&L or a balance sheet. There is a financial angle to taking institutional funding, which comes with a responsibility to return a certain multiple to whoever is investing in it. So hospitals are going to be very wary of any solution that's only talking about clinical improvement or patient improvement. That is a given. But if you're not able to support it with a business case, which is about either revenue improvement or cost reduction, then I think you are not going to be able to make inroads into an already long sales cycle within a hospital, because hospitals are very slow decision makers. They are, obviously they need to be very sure. So that's why the pilot story that we spoke about is fairly common. Therefore, if you're going in, don't just go in with a passion that you are here to change the world and be divorced from the realities of the P&L. I think a lot of innovation that I see, and I used to see this in the healthcare domain, a lot of people used to come, they used to go back very sad that I have such a solution, it can make a difference. But if it is not backed up with a business case, it doesn't make sense. So don't be idealistic. Uh, if you have a good solution, start working on real customers and real business cases before building on your dreams. That I think is very important.
But isn't that a huge power disadvantage in this equation? Because the pricing power is definitely with the hospitals, isn't it?
So the profit pool is there in the hospital, no? And when you see the same price sensitive customer, if he goes to a hospital and he sees a certain price that is being charged, the suddenly the patient is not actually bargaining beyond a point, right? It is insurance that is paying, or out of pocket expense, even if it is very high. How much you don't see a aloo pyaz sort of negotiation that happens in hospitals as common as you see it in other components of the healthcare chain, right?
This next question is about, you're in a domain where people need to be made aware about the requirement of your product. But a startup already has limited funds, especially bootstrap ones. then how is it possible to spread awareness while making enough ROI from selling campaigns?
It's a chicken and egg situation. I think founders need to figure out ways to market their product today. A lot of forums are free, and therefore I will take this opportunity to thank CII West to give me this opportunity. It's a free event that way, so it gives us some. It gives us some, publicity. Uh, and I think one of the things that we also learned is there has to be some marketing budget after a point.
Mm-hmm.
And if you are, sales and marketing are real requirements in any startup. Don't be under an impression that just because you're doing some great work, people have time and they are going to talk about it wherever they go.
Mm-hmm.
It doesn't work. So you get real. I mean, I think one of the, again and again, I'll keep talking about getting real and building real operations, building real P&L, making real assumptions. These are very important. So if you're bootstrapped and you know you're bootstrapped and you don't have money, get help. I mean, talk to people, use your good friend ChatGPT to generate content if required, do whatever it takes. But in today's world uh, with digital, events, with digital media, social media, and the ability to sort of go speak in various circles to tap into your network. So there are two parts to it, right? One is there is a massive network out there that you might have already built, and but you're still not public in the sense, for example, PocoCare should be fundamental right for every Indian. That said, we are talking about maybe at least 50 crore people that should be using PocoCare. And to be able to reach out, it's not going to be easy. So we are scaling through insurance, through corporates, where we believe we can get to at least about 20 crores. And that's not a bad number. Even if we can get to about 10 crores, it is 5 to 7% of the overall Indian population. And the way I look at it, Milan, is, if there are 24,000 deaths that are happening to 100% of the population, my dream is 1,000 plus lives to be saved.
Right.
I'm talking about at least crossing 4% of the country in terms of coverage. And therefore, insurance gives me that, sector that can help us realize our vision and dreams. But does it need marketing? My earlier thinking was maybe not, but now I've changed my view and I'm like, you got to make the right noises and you got to be heard. I hope I answered that question. Yeah.
You did, and that this is related to another question. I didn't realize the role the big pivotal role that insurance plays in this whole game. So the question here is, who is the true customer in healthcare? The payer, which I suppose who could be the insurance company, the provider, the hospital, the patient, or the regulator?
The regulator is not the customer. The regulator is the I think we need to. I mean, the name of the company is Positive Conversation. So we should look at things from a real point of view and a positive point of view. Why do regulators even exist? It is not to pain the startup. They exist. For example, privacy laws can be super brutal for a young startup that is operating in this space. But you have to make that investment. You control the controllables, as Dhoni says, right? You control the controllables. The second point is who is the actual customer, and you define this in two ways. Who are you existing for? In our case, it is that life that can be saved, or it is the life that needs to get the patient that needs to get to the hospital in the fastest possible time. If I dilute that vision and I start looking at defining my customer in terms of who is paying, uh, I will not be able to do anything. But then the reality is I need money to run my business. So then we get into who is the payer, and the payer can be anybody. It can be the family member, it can be the employee, it can be the corporate, insurance, TPA, whoever is basically willing to embed our app or willing to buy a subscription. is the person who is paying. So if I define my customer, there is some overlap. So what I'm saying is be very clear in terms of paisa kahan se aa raha hai, who's paying, and be very clear about what is it that you are impacting and why do you exist and who is going to pay the money for it. So it can't be answered as, this is the payer or this is my customer and I will go full hog and try to please that person. And regulatory requirements in healthcare is going to exist and it is going to be brutal. So if somebody has entered the healthcare space, you have signed up to be aware and you have signed up to basically comply. There is no escaping that. So you got to keep a budget separate. You got to basically be working along. There are no shortcuts there. So I wouldn't call them a customer. They are speed breakers rather than a steering wheel or a brake in a car. They are basically the speed breakers on the road, but necessary to maintain that speed along with the right direction.
But there's a question here about regulation. Does regulation actually kill innovation, or does weak compliance kill startups? But before you answer that, my wife is a physician. She's an oncologist. So we have lots of doctors who are friends, and I asked them a similar question, and I got an interesting insight. In the less regulated parts of healthcare, I understand that people try and come in and try and monetize whatever they've done very quickly, and they don't do adequate R&D. So then it's a question of rubbish in, rubbish out. And in places where there is a lot of regulatory friction, then that sometimes delays the whole rollout, and so not having regulation is difficult for the customer, and having regulation it delays the project. So what do you think? Does it kill innovation, or does weak compliance kill startups?
No, I think it cannot kill innovation. That is too extreme a view. We are talking about people's health that can result in somebody's life or death, right? So to expect that regulation will not be there is not practical. It has to be there, but I think therefore, there might be some people who are from the VC world or investor world, etc. Therefore, I think the thing that happens is in healthcare, the patience required is much higher because the ability to show that your solution is working and real on the ground may take more time. Therefore, your unit economics, break-even time, etc. So there is a lot of patience which is required if you are actually an investor in the healthcare world, and if you are a startup founder and coming from a different industry, reset your expectations. It's not like people are lazy. It's just that the regulatory requirements can slow down your progress, or it may seem like things are slowing down, but it is actually required. So I don't have too many complaints because I'm sort of willing to grind it out and face reality. At the same time, another advice for the startup folks who are there is, if you are in the healthcare startup or any startup, uh, start tracking the regulations and the trends that are going to happen sooner, and don't just think about your solution and live in a island. It's very important to start looking at what policies can come up, what can happen. For example, the Privacy Act has a massive change in impact on how the startups need to rethink. And if you're not ready, then you're going to spend a lot of time, and it is going to push you back by another 6 to 7. It's a necessary table stake, so it's going to push you back by 6 to 9 months if you're not proactively worked around it.
You spoke about investors, so we have a question relating to investors. But why is clinician buy-in harder to obtain than investor buy-in?
You have a wife who is a clinician. So you know the answer, but let me answer it. So in clinician buy-in is more difficult than investor buy-in. That's a question, right?
Yes.
Uh, it's a very, I think somebody has got hurt in the process of trying to, this probably comes from experience. But in my view, I think I've worked with several doctors. Uh, the clinician buy-in is very cautious, very caution driven. They won't accept something because you sound very innovative. For
Mhm.
them, the patient care is very critical. And
Absolutely.
if you look at the tech promises that happened through, let's say, some EMR platforms without naming them, or clinic, platforms, they felt that the hold on data that they had, went off. So the past history also has to do with a lot of distrust and keeping the patient at the center of things. They need time to be able to see. It's a chicken and egg situation, right? You're saying something will make your life better, but there is no proof that exists, or if there is proof that exists somewhere, it may or may not be applicable to me. So there is a lot of time that it takes to get the clinician buy-in, but once you get it and you have a clinician who is committing, then I think they are the ones who are actually making a difference to the patient. So once that buy-in you actually are able to get, that's where the product market fit starts to fit in better. For investors, if you are innovative, if you're different, and you are clear, I think the market has also moved from promises to unit economics based, real business driven, uh, promises that you can make. And if that sounds real, I think investors are sort of industry agnostic. So it's not about a clinician. I mean, you can never compare a clinician with a VC that way, or an investor that way. Hope.
I completely agree with you about the trust part, because uh, almost every doctor I spoke to said that the startups that don't make it do not have not invested enough time and effort to building confidence, trust,
Yeah.
and credibility with doctors. So yeah, that's for sure. Ranga, I'm afraid we've run out of time. I think we'll have to wrap here. But
Oh,
thank you so much. This was really, really interesting, and I'm sure the audience will agree with me on that. So may I thank all of you for having joined us, and please make sure that you join the CII Startup Buzz every Thursday, sharp at 5. And I'm sure most moderators aren't as technically challenged as me, so they will normally start at 5. Thank you, everyone. Bye.